These knee pain videos have had over 1 million views, and I've put the best advice into this one video for you. Let's have a quick look at the content. We'll start with a secret knee pain reducing massage technique that you can do for yourself. Then we'll look at what one of my viewers described as the witchcraft taping technique. I'll show you the best exercise for strengthening up the muscles around your knee, which should help to reduce knee pain. We'll have a look at how to perform some pain-free squats. And for the final technique, I'll show you a new device that we've been testing for a more lazy approach to pain relief. So let's get started with the secret massage technique. Not many people know about this technique, and I discovered it in some research in 2009. It's called a fascial manipulation technique. So I'm going to demonstrate on this side. I just pull my shorts up. You will need to get access to the skin, so make sure you're sitting in appropriate clothing. Then starting from your knee, come 2/3 of the way down your thigh and then out laterally. You're looking for a particular point which is tender when you press on it, and it's in between two muscles called the rectus femoris and the vastus lateralis. I'll put a picture on the screen here to show you the muscles of the thigh and where this tender point is typically located. So you can see it on the screen here and also on my leg. So it's at that division between the two muscles you'll find a tender point. I'm going to just go ahead and mark mine on my own leg so you can see where that is. Get a quick zoom in so you can see that. So once you've identified that tender point, you can press and sustain that pressure for 60 seconds to perform the first part of the treatment. You could use your thumb, your knuckle, or a massage ball. An alternative to applying downward pressure is to use some negative pressure. So here I'm going to use a silicone suction cup. This is a RockPod. So what this is doing is applying negative pressure over the area, and I can certainly feel it, but rather than pressing down, I'm lifting up. Once again, I'll hold this in place for 60 seconds, and I can increase the negative pressure by gently pulling the cup away. This is a slightly more comfortable experience and easier to apply. After 60 seconds of applying the pressure, you then want to do 30 seconds of friction massage over the area. So you could simply use your hands like this. You could once again get the massage ball and use that, but instead roll it around the area and up and down. Or you could use a massage stick. If you don't have one of these to hand, then a rolling pin from the kitchen will suffice. And this is a nice easy way to apply a massage down over the area and further down over the lateral thigh as well. So I hope this technique helps. I find it to be very effective for reducing pain around the kneecap and the patellar tendon. So after performing this technique, knee loading and flexibility should be easier and less painful. This next technique is the one I've named the witchcraft technique, after a comment from one of my viewers who goes by the name of Inkman Sam. So thank you, Inkman Sam, for the excellent name. I hope your knee pain has reduced and you've shared the video with family and friends. So to get started, come in and I'll give you a closer look. Let me start this one again for you. So you're going to need 2 pieces of kinesiology tape. Here I'm using RockTape. This is RockTape X Rayon. I'll put a link in the description. And this tape, guys, comes pre-cut. But if you don't have pre-cut tape, then you'll just need a decent pair of scissors to cut 2 strips of tape long enough to wrap around the knee, like so. So I've got one there and another one which is going to go around the other way. Take your first piece of tape and start it at the top of the shin. If you come to the top of your shin, you'll find a knobbly bit at the top there. So I've put a red dot there for you to see where that is. Let me zoom in a little bit more for you. Okay, take your first piece of tape, peel away the backing paper, and then stick the tape over that red dot at a 45-degree angle. Stick the tape down, secure it in place, peel away the backing paper, see the backing paper coming off there. Give the tape a gentle stretch, and you need to stretch the tape gently so that you can then get it to stick around the kneecap. So you're wrapping it around the knee. The other name for this technique is the knee wrap, because it wraps around the kneecap. Once that's in place, make sure it's stuck down. I've got a few hairs on my leg there, which is not a problem. The tape will stick down over the hairs. If you find the tape is floating on the hairs, then you will need to trim the leg hairs in order to get an effective adhesion from the tape. So that's the outside of the knee wrapped. Now we're going to do the inside. So we'll start again over the existing tape at that 45-degree angle. Peel away the backing paper so you've just got a little bit left at the end. Give the tape a gentle stretch, and then once again wrap it around the kneecap, and then as you can see you end up overlapping the existing tape on the top. Stick the tape down, make sure it's secure and stuck down, rub over the tape just to really fix it onto the skin and perhaps warm up the glue a bit and get it to adhere a bit better to the leg. Once it's on, make sure you can still straighten and bend the knee and the tape doesn't come off. Probably worth giving it another quick bit of a rub once you've done a few movements. The tape should feel comfortable when you move and hopefully improve your pain-free range, perhaps making walking and going up and down stairs less painful. Let me know in the comments how you get on. One quick important point about the tape, take the tape off at any point if it's itching or irritable, and the first time you use it, just leave it on for up to 1 day, but take it off before you go to bed. If it's helpful, then perhaps next time you can leave it on for a little bit longer. Any questions, make sure you get some medical advice. Next, I'm going to show you an exercise called the slider lunge. It's a great exercise for strengthening the whole leg, especially the muscles around the knee. So start in the lunge position and place something under your rear foot that will slide on the floor. Here I'm using a slide disc. I'll put a link in the description. So start in that lunge position, and the leg that does most of the work is the front leg. But of course, make sure you do both legs. From that position, drop down so your torso goes straight down towards the floor and back up. And repeat, slide back, drop down and back up. Drop your torso straight down towards the floor and back up. If you feel the exercise is too easy, then of course you could add some weight by holding a weight in one hand, or try taking your slider leg out in different directions. You could go back, hold, and then slide the disc out and around and back up. So there's lots of different variations that you can do. I'd recommend doing between 6 to 12 repetitions, 2 to 3 sets, and performing this 2 to 3 times per week. If your knee pain gets worse during these exercises, then please do stop and make sure you get a professional assessment. But hopefully you'll get on well with them and you'll notice an improvement in your leg strength and a reduction in your knee pain. Squats can also be a great way of reducing knee pain by strengthening the muscles around your knee. But if you're experiencing knee pain while squatting, try one of these 4 simple adjustments. Adjustment number 1, you may be kneeling forwards too much, so stick your bum back more to load up the muscles on your hips. Number 2, try a wider stance. Sometimes squatting with a wider stance can distribute the load differently through the joints and reduce knee pain. Adjustment number 3, improving the range of motion in your ankles and hips can sometimes take some of the strain off your knees. To improve ankle mobility, go down into this kneeling lunge position and then push your knee forward over your toes whilst keeping your heel down on the floor. Move as far as you can, hold for a few seconds and back. Then go out slightly laterally over the little toes, hold and back, and then in medially across over the big toe. As far as you can, hold and back. Perform this 3 times on one ankle, 3 times on the other ankle, and then follow up with some simple hip stretching. One leg out straight, the other knee hugged up over your chest, then hold the ankle to rotate the hips, and once again pull up over your chest. Hold each stretch for a few seconds. Repeat on the other side. Performing this mobility routine for a couple of minutes before any squat sessions should help to reduce your knee pain. I hope those exercises and techniques help. Please do share them with family and friends. Now you may be looking forward to the lazy way to reduce knee pain. So here it is. Now it is important to do the exercises and to keep active, but of course when you are resting or if you are sedentary at work, for example, then this is a device that we have been testing with positive results. This is a pulsated heating knee sleeve from a brand called Hydrogun. I'll put an affiliate link in the description. So what you do is you put it on. It's only to be used when you're resting. It does look a bit like a knee support, but it's not to be worn whilst you're moving around, and you'll see why. It's battery powered and you switch on the module on top, get it going, and you can set the speed of the vibration. There's 2 vibrating pods here, each side of the kneecap, and they vibrate, which offers some pain relief. And you can increase the frequency of the vibration as well, so there's less time in between each vibration. And then you can also adjust the temperature from 40 in 5-degree increments up to 70 degrees, which is really quite warm. So then after a couple of minutes, you'll have the vibration and the heat around the knee. Vibration is known to be an analgesic, that is a pain reliever. And we all know that heat can be very comforting as well. So that's it. Once it's on and set, you can lie back, relax, get on with your work, watch TV, do some reading. This does actually feel really nice, so I'm going to leave it on while I finish the video. If you're watching this on YouTube, then hopefully we can help you further with one of our other knee pain videos. If you're a health professional and you're interested in creating videos like this for your clients and of course for the wider YouTube community around the world, then you may be interested in some free training teaching you how to get started on YouTube with your first video. And I'll put the link in the description.